Okay, so just quickly checking to make sure we're actually live. Okay, perfect. Sorry for the delay for anyone who's, super on time and joined us. Wanted to make sure that we were broadcasting as we should be. So welcome and thank you for joining us tonight. I'm Gabby from the Addison Public Library, and I'm one of the Adult Services librarians. Tonight we have Hamdard Healthcare. So we've got Quinn and we've also got Monica. If you guys would like to kind of share with us what you do at Hamdard.
So my name is Quinn. I'm a pandemic health navigator at Hamdard, which means I'm specifically focused on vaccine distribution and providing people healthcare and resources related to the COVID-19 pandemic. Monica?
Yeah, I'm Monica. I'm the Pandemic Health Navigator Supervisor. So I'm working on some of the same projects that Quinn is as well.
Okay, so since we are live and ready to take any questions you have, feel free to drop them right in the comment box below, and then we'll revisit them at the end of the brief presentation that they've prepared for us. And then just a quick thing, si alguien está escuchando en español y tiene preguntas sobre la vacuna, las pueden dejar ahí en los comentarios y yo la puedo preguntar en inglés, y ya cuando ellos contesten, la puedo cambiarla otra vez en español para que ustedes puedan entender. So yeah, if you feel shy and would rather not leave any comments, we'll also follow up with you at the end of it all, but feel free. We've all got the same questions, so just drop them below. All right, well, off to you guys.
Great. So before I get into some of our frequently asked questions, I wanted to say a little bit about what Hamdard is and what we do. So we're a nonprofit community health center, and we've got 3 locations. So one here in Addison, and then also in Chicago and Bensonville. And our services include primary care, so like going to your general doctor for general health needs, behavioral health, mental health, and community education services like this one. And specifically, you might have heard about our vaccine clinic that is happening at the Addison Public Library. Currently, we have appointments open on Tuesdays and Wednesdays between 9:30 and noon. We're specifically giving out the Moderna vaccine, both the first and second dose, and that will be free regardless of insurance. And that should be true for anywhere that you sign up to get the vaccine, not just our clinic, is that it should be available for you free of charge. You can sign up using this link I've got here, zocdoc.com/vaccine, calling this number, or you can always talk to a librarian and they can help you schedule a vaccine in our clinic. So I wanted to start this off by talking about why I got the vaccine, because I was definitely nervous, partially because I think, like a lot of people, I'm really scared about needles. I don't like getting needles in my body, and I was just nervous to get a new vaccine. But why I ended up deciding to do it was partially to protect myself, right? That I was really scared of the possibility of getting COVID and having it really, really seriously affect me. And then I also really wanted to protect my family and people in my community. I really missed seeing my parents and my grandparents, and I didn't feel comfortable visiting them because I knew that being unvaccinated, I had a pretty high risk of possibly passing on to COVID to them. So it was partially to keep myself safe, but also to keep the people that I love safe. And so now I've got just some frequently asked questions that people have about the vaccine. So you might have heard, right, there are a few different types of vaccines that are currently authorized and available. We've got Pfizer, Moderna, and Johnson & Johnson. And they're all effective, but they're all a little different, right? You can see in this chart, they vary in terms of effectiveness. Moderna and Johnson & Johnson are only available for adults, people over 18, but Pfizer is authorized for anyone over 12. And Pfizer and Moderna both require 2 shots, right? So you have to come in and get a shot, and then a few weeks later, you have to come back and get a second shot. Whereas the Johnson & Johnson vaccine is only 1 shot. Another common question we get is, how do we know the vaccine is effective? And basically, there have been large-scale clinical trials where scientists studied large groups of people, some of whom had the vaccine and some of whom didn't have the vaccine. And they found that people who had the vaccine were much less likely to get COVID-19. So this means that if you get the vaccine, you will be a lot less likely to become severely ill from COVID or to pass it on to others. And I have just one example of this is some of the information from one of the many studies done. I got this from the CDC, but this is an example of a study where they followed around 4,000 frontline workers, so healthcare people, first responders, people who are interacting with a lot of people, and found that people who were fully vaccinated were 90% less likely to get infected by COVID. So that's the kind of effective rates we're looking at. And then I think people's other big question is, oh, okay, we know the vaccine is effective at preventing COVID, but how do we know that it's safe? And partially the answer is the same. There have been clinical trials that found that everything went okay, right? Also, since those trials, a lot of Americans have gotten COVID-19, like 259 million doses. That's a number that I can't even wrap my head around. And doctors and experts have been tracking everything very closely to make sure there aren't severe reactions. And I think a good example of this is, you probably heard in headlines, the Johnson & Johnson vaccine was briefly paused when there were a few rare severe reactions in order to study it and make sure that it was actually safe. So I think this is evidence, right? It's sometimes scary to hear, oh, a really rare reaction occurred. But I think the fact that the doctors talk about it, advised everyone to pause, and investigated further shows us that if there were any bigger problems, we would know about them. So I want to talk more about the Johnson & Johnson vaccine because it's a little confusing. Basically, what happened is that in 7 people of the 1 million people who were observed, they had blood clots, right, which can sometimes be dangerous. All of the people this was observed in were women under 50. And so when we found this out, the vaccine was paused in order to determine if this should be listed as a potential side effect. And it ended up being decided that the benefits outweigh the risks and that it is safe to use, right? So it's worth noting that this is still a very, very small risk, but it only happens with the Johnson & Johnson vaccine, not with Moderna and Pfizer. It's very, very rare. You see this tiny percent on the screen, and it's only been noted in women under 50. So those are some things to keep in mind with that one. A lot of people ask, they get nervous of like, oh, will the vaccine make me sick? Is it going to give me COVID-19? And no, the vaccine does not give you COVID-19. But you might have some side effects. You might not feel very good because your body is practicing fighting off the virus. So it knows what to do if you ever do encounter the virus, right? So the most common things people have is where they got the shot. It'll hurt a little bit or swell. And then sometimes in the rest of their body, they'll have headaches or nausea, chills. I had some of these symptoms after my second dose, where for sort of 24 hours after, I was really tired. I didn't feel like eating. I was kind of feverish. So I had to stay in bed that day. And it's definitely not fun, but these side effects don't tend to be severe, and they should go away in a few days. And if they haven't, that's definitely something to talk to your doctor about. And then finally, because the CDC keeps updating their guidelines, I wanted to let people know what the current rules are. So for people who are fully vaccinated, that means people who have waited 2 weeks after their final dose, they can go to any events, whether they're indoor or outdoor, without a mask. Right, and so that's an update they just made. It used to be advised that people who were fully vaccinated still wear a mask in some cases, but now it is advised to do any of those events without a mask. The exceptions include if you're traveling, if you have COVID symptoms, or if you're in a place that has different rules. So for example, you probably know that if you go to the library, you have to wear a mask, even if you've been vaccinated. So you still have to follow those rules. And finally, since this was also just announced, is it safe for my child to be vaccinated? And the short answer is yes, if they are over 12. Kids and teenagers 12 to 18, it is safe for them to get the vaccine, but currently the only vaccine they can get is Pfizer. We are not offering Pfizer at our clinic, so if you have a kid or teen that wants to get vaccinated, you can probably talk to a librarian or look at some websites online, look at maybe your local Walgreens, and you should be able to find options, but you're going to want to look for that Pfizer vaccine if you're looking to get a kid or teen vaccinated. And then I wanted to answer some of the questions that we got through that Facebook posting. So someone asked, after being fully vaccinated for some time, does it seem like you get more headaches than you would normally get? And I would say that, so headaches is one of the temporary side effects that some people get after the vaccine, right? So in the couple days after the vaccine, they might have had a headache. But if someone has been vaccinated for some time, so more than a few days, and they're getting headaches, that is like not a normal symptom that we see associated with the vaccine, and it's definitely something to talk to your doctor about to get more information. So this is not a typical response to the vaccine, I would say. A really good question. Why do I need to be vaccinated if so many other people are already vaccinated? And there are sort of two answers to this. One, we recommend getting vaccinated for your personal safety, right? There are a lot of people out there who are vaccinated, but there are also a lot of people who still aren't. And you don't know when you interact with a stranger on the street or at work if they're vaccinated or not. And if they're not vaccinated, there's a pretty high risk they could pass COVID to you. So personally, right, that's part of why I got vaccinated, even though lots of other people are, is I want to protect myself. And then the other side of that is, like I mentioned earlier, protecting our families, our loved ones, the people we care about, our communities, right? And basically, it's always helpful as more people get vaccinated, right? Every single one person who gets the vaccine, that makes a difference, right? Because that's one more person who is less likely to get COVID and less likely to spread COVID, right? So it's important that everyone who is able to get vaccinated does get vaccinated, even if a lot of people have already done it, because just one more person getting vaccinated makes a difference in terms of building a safer and healthier community for everyone. Okay, and this is a question people ask a lot. Will I feel sick after one of the shots? Maybe. There's a good chance, right? After my second shot, I felt pretty sick. So I would say if you want to be really careful, you could plan, okay, just in case I feel sick, if you're able to take off work the day after or schedule your shot so that the next day you can relax, stay in bed, drink some fluids. There is a chance you might be sick for a day or so after one of the shots, but it should not make you sick in the long term. If it does, talk to your doctor. But yeah, so that is one of the downsides of this vaccine, is the side effects can be annoying. But as I experienced them myself, it wasn't that bad, and I think it was definitely worth it. And finally, why should teens get vaccinated? Well, for the same reasons that adults should get vaccinated, but especially because they're going to be wanting to go back to school, right? I'm sure if we've got any parents out there whose kids have been doing virtual learning for the past year or so, it's really, really tough. It's really, really hard. And I think for so many students, right, it's best for them to be in person at school. And having a lot of teenagers in one place, that's a really potentially high risk environment where if one of those teens had COVID, it could spread really quickly between them. So it's really important for teens to get vaccinated so that they can go back to school safely without putting themselves or the people around them at high risk for the virus. So that is all of the questions we had for today. I'm going to stop sharing my screen, and if anyone has any questions and they're watching live right now, you can put them in the comments and we can respond to them now.
I'm muted. So it looks like we haven't gotten any questions yet. If you're watching and have any questions, feel free to comment them below. Maybe it's not necessarily about the vaccine, but just COVID related. We can try to answer those as well. And if we can't get answers for them right now, we can always follow up and get that information for you. It's good to have a community partner like Hamdard Healthcare that we can rely on for, medical information and advice, because even though librarians have plenty of answers, unfortunately, medical advice is not something I studied, and it's not something we can really provide. So that's why we've got these guys to come share their information. Speaking of those side effects, I did get nausea, and it did kind of suck, but it went away after the first 24 hours. Whereas when I got COVID, I lost my sense of taste and have not properly regained it yet. And that was back in November. So when people ask, should I get the vaccine? I was like, well, maybe I wouldn't have lost my sense of taste. I got lucky enough that it didn't escalate, but at least, I mean, it still kind of sucks. And luckily, no one in my household got sick. So that's one thing now that we're all vaccinated and I don't have to like worry about. So yeah, I think we'll give it a couple of minutes if anyone has questions. If not, we'll go ahead and leave. But yeah.
Yeah, I think that's a good point you make, Gabby. I just lost my train of thought, of course. But yeah, I know, a lot of people say that the benefits of the vaccine are really worth avoiding the risks of COVID. Yes, you might not feel great, but one, that doesn't happen to everyone. Some people feel perfectly fine. And two, you could experience a lot worse symptoms with COVID. I know when my parents received the vaccine, I was nervous. I was like, oh no, like they're not going to feel good afterwards. Like, I hope it's not worse for them. They're a little bit older and things like this. And they felt perfectly fine. So it really is individualized for everyone. And I think I'd like to put out too, we are pretty regularly at the Addison Public Library. So I think if anyone wants to stop by the conference room, and I know this can be a tough decision for some people to make about getting vaccinated, so you can always stop by our room and talk to some of the people we have at the front desk, maybe even talk to one of the nurses or providers if they're available for a minute, if you have a more medical question that's specific to yourself. And we can really talk through, what specifically it might look for you to receive the vaccine individually, or even as Quinn mentioned earlier, looking into trying to get you set up with a Pfizer vaccine if you're looking for someone younger, or a Johnson & Johnson vaccine if you're looking for that single dose. We can help with making those appointments as well.
Yeah, I think it was last week I was able to find on 2 different occasions same day appointments. So even though it has been such a difficult journey trying to find vaccines and waiting for like our levels to be open and eligible for vaccines, we're definitely here to help, especially with Pfizer, because that of the younger age ranges that can get it. But if you need, you're going to go out of town and you just don't have the schedule for a second dose, the Johnson & Johnson, we can also help find that for you. I had a question actually. For the Johnson & Johnson, we had 60%, 66% effectiveness. That's supposed to rise after a couple of weeks, right?
Honestly, I'm not sure about that. I can double check it. I'm
Okay.
gonna do a little looking right now, but Monica, do you?
Yeah, Quinn, if you want to double check, I want to say though that is the overall efficacy of it, even after the couple of weeks. And I do know that that seems low compared to some of the other, to the Moderna and Pfizer vaccines. And I know that, that has made some people less interested in Johnson & Johnson as well. But actually it even though compared to the other rates we see it looks low, it's actually still really, really effective. We're really fortunate to get Pfizer and Moderna that had efficacy rates in the 90s. And so the Johnson & Johnson vaccine, that 66%, is actually pretty close to what the flu vaccine efficacy is like each year. So although it seems low relatively, it still is effective and falls within that range of other vaccines.
Okay, I'm gonna, if that's okay, share my screen real quick again. Yeah, so I'm looking at the CDC website right now for this. This is where I got the statistic of the Johnson & Johnson vaccine. Yeah, so that's 66%. 2 weeks after receiving the vaccine. But we don't have a number right necessarily for this, but it was also highly effective at preventing hospitalization and death in those who did get sick. So yeah, like Monica said, it's still remarkably effective, very, very effective relatively, at reducing people getting sick from COVID in the first place, and very, very, very good at stopping them if they do get sick from being very seriously, dangerously ill.
Yeah, I mean, and especially combined with our other efforts, I know at the library we've tried our best to make sure we keep sanitizing services. The CDC said that may not be as high of a transmission, but it's still, just to get that concern out of the way so people can safely like browse and come into the building. We did go a couple of months without people in the building, and I mean, it's been great to see everyone and just there's nothing like going through the shelves and finding the book or movie you're looking for instead of just being like, hey, librarian, find me some books. So we're happy to do either. But even with that 60%, 66%, it's good to like combine it with our mask wearing, which is why we're going to keep it just until we reach phase 5, I know, at the library. And then just social distancing as much as possible. So yeah, well, it doesn't look like we have any questions. So I think that will be all for tonight. Thank you for sharing the updates and just, helping answer questions about the vaccine. It can still be daunting, and just, especially with the Johnson & Johnson scare, it's good to know, the information, side effects are like temporary. We haven't had any like serious side effects, and especially just everyone's doing a little bit better to stay healthier and, make sure we're taking care of each other.
Yeah.
So, thank you for joining.
Thanks so much for having us.
Yes, thank you.
It's great anytime we can have this. And if anyone's joining, watching this after the fact, feel free to shoot us an email at the Addison Library, or you can go ahead and call Hamdard Healthcare directly if you want to skip the middleman. And if you have any other medical or just like health-related questions that you'd like us to tackle next, I'm sure we can tap into Hamdard's wealth of knowledge and share just more health information whenever we can. Okay, thank you. Have a good night.